everybody. I am very happy to have quite an inspirational person with me today. And we intend to have a conversation on pain and suffering and how one can transcend suffering like a trooper as she is. Now, when we think about it, life is suffering in many different ways. One of my favorite intellectuals of this era and a clinical psychologist, Dr. Jordan Peterson, poses this question to everyone. Does suffering justify the wisdom it produces? It is a very tough question to answer. However, I have with me someone who not only took the wisdom to transform herself, but also immensely help other people transcend a very similar suffering. Justin, very happy to have you with me today.
I am so honored to be here, Kavya. I really, really appreciate getting to talk with you today. And that was quite an introduction. Thank you.
Absolutely. So, Justin, can you elaborate on what CRPS is and how long it took for you to actually get the official diagnosis?
Yeah. So CRPS is short for complex regional pain syndrome because it's a complex painful syndrome in a region of your body, but it's more than a chronic pain syndrome. It's kind of mislabeled as that. It's really more of a neurological autoimmune interplay. And when you don't understand what causes a disease or the mechanisms behind it, it's very hard to treat. And so they don't know what exactly CRPS is or what causes it, but there is this inflammatory response to a part of your body, typically starting in one extremity, hand or leg, right? It can be from something minor, like you rolled your ankle, getting blood drawn, a small surgery, or something major, like crush injuries are also responsible for a relatively large percentage of CRPS diagnoses, but it's rare. It's an orphan disease. There's very low awareness in the medical community, unfortunately, about it typically until you end up in chronic pain. And then there's some knowledge of it, but it's very difficult to treat because despite how excruciating it is, other than in earlier stages of the disease, it can be largely invisible. And there's no tests that conclusively diagnose it. It's not like I took a blood test and, you have CRPS, right? So the diagnosis is the combination of what the patient says and explains their history and what the doctor sees during an exam. But what makes it really hard is they're like 20-minute exams, right? And with dynamic disabilities where the symptoms are changing, right? During the day, my leg looks very different later versus earlier. Swelling starts to accrue. If I walk too much, then the veins bulge and it gets red. So you can see it. It's not as invisible as, it's made out to be in a way, but compared to how excruciating it is hard to see and identify. And so it took me, I was lucky, 8 months to get diagnosed. Many people go like 8 years. I think the average is more towards that end. And the problem is if you don't treat this soon and early, it's very difficult to treat because it sets in your nervous system and you can't just undo it, so sooner treatment is critical. And unfortunately that's challenging when awareness is low.
Yeah.
So I went through seeing, what was it? Like an orthopedist, endocrinologist, physiatrist, a PA of that person, a podiatrist. I was in PT, orthopedic surgeon, nobody. Okay. And I was bringing in papers like, do I have compartment syndrome? What my leg at the time was, you could see it was nuts and the bruising and the swelling. And the symptoms are, it feels like your leg is being like electrocuted, like bugs are crawling all over your leg. It burns, stings, tingles. Your muscles feel like they're tearing, they're pull, very stiff. Your bones feel like they're aching, like you could just snap it like a redwood tree, or like Tanya Harding just shanked my ankle. That's what it feels like. And it looks pretty normal, which is what is bizarre about it.
You said like 8 months is a short time, but man, 8 months of going through this, that is like I can't even imagine that, Justine. So was there a specific trigger or that you can recall on when this all started? Or do people recall having specific triggers?
typically, I mean, if anything, people will at least recall when symptoms started, right? When, oh my God, suddenly for no reason often is, but for me, what happened was I was very sedentary and sick, unfortunately, for the 9 years prior. We don't have a lot of time to get into that, but I had a brain injury previously, which, I was largely like bedridden. I didn't move. I couldn't take care of myself. I had no self-care skills. I was on so many medications, insomnia, GI problems. I couldn't function at all. And so as I started 9 years fast forward, to climb out of that a bit cognitively and be able to jog around the neighborhood, before I couldn't even walk because I would get lost. My memory was so impaired. I was so cognitively messed up that I would get lost walking around my own neighborhood I lived in for, 20 years. So I was like a child, basically. And as I started just being a little bit more active, then my shin, I had this really extreme pain in my lower leg, one of those jogs at like a 1 mile mark. And I was like, what the heck? And I had to like limp home. And then it just got worse and worse, and the swelling and the tenderness. And eventually, we did an x-ray and they could see a tibia fracture, but it was just a hairline, fracture. It wasn't a major thing. And the symptoms, the classic thing with CRPS is even if there's an injury, the response to it is dramatically out of proportion.
Hypersensitive response.
Yeah. So they could identify that at least, but I also by then already had bone loss in my leg at 30, I had osteopenia. And so I think the CRPS was prior possibly to the fracture. And then that bone loss led to a fracture as I started to become more active, but I'll never really know, chicken or the egg. Did the fracture cause CRPS? But then I wouldn't have had bone loss so fast. Yeah. So because it's in your brain, right? I think it was kind of developing and then it just.
Yeah, I guess that's why it makes the diagnosis of CRPS so complicated, and that you have to go through several different specialists. So finally, when the diagnosis was made, it was by a chronic pain specialist who made the diagnosis, or who actually made the diagnosis?
Really, me, basically. What happened was finally the orthopedic surgeon at the end of that long line ordered a bone scan. And that's about the only test. There's other ones, nerve conduction studies, but a lot of people don't have bone remodeling or bone loss. You don't necessarily get that. It's typically later on. So then it would be negative and you could still have CRPS, right? But luckily, in a way, my left leg lit up like a Christmas tree. And so then that, coupled with all the previous symptoms and me explaining like what I did to you, what does my leg feel like, even if you can't see it? And then the atrophy, the amount of atrophy from limb guarding, from not being able to put your foot on the ground and bear weight. I did everything on one leg for like a year and a half. I'm everything. Wow. And then you realize that doesn't work either as a long-term strategy, right? And it's reinforcing your brain sort of disassociating from that limb. And it's a very bizarre progression of the.
This is not very uncommon, where patients, after going through like multiple physicians and not having a good diagnosis, are actually getting to a point that where they're diagnosing this.
Yeah. And so that's when I was like, hey, that with this, and of course he agreed. And then I was then officially diagnosed. Then I was sent to a chronic pain, the wing of UCSD that does that, where I met Dr. Chakravarthy. And that's where then at that point, at least once you know what you're dealing with, you can start to treat it. But the problem is it's very often too little too late, which is kind of what happened with me. By then it's chronic. You can manage it, you can improve it, you can change a lot. It's my whole life's purpose, but it's not just going to go away. Right. Most likely, miracles, right? I too hope, sure. But I don't live my life waiting that something is going to just change it.
Yeah, I love that attitude, by the way.
Yeah.
So once you had the diagnosis, what are some of the initial treatments that you went through? Did it help, not help? If it helped, like how long did it help?
Yeah, those are great questions. Because of my previous history with the brain injury, the way that I approached this, I think, was a little bit different than maybe a typical patient. I had been on like 100 drugs in 4 different classes, right? Antipsychotics, anti-seizure, anxiety, pain medication, like the combination of that, I did not want to repeat essentially again with just a different situation. The challenge is there's not great treatments for CRPS, right? Because of what we talked about earlier. And so I started with something pretty typical and benign, gabapentin, right? Nerve pain med. it worked decently enough to at least shave off some of those external, for me, like the skin sort of sensory symptom bucket. It shaved off a little bit enough for me to start to then use movement as a tool and a way to desensitize and change the way my nervous system was responding, overreacting to stimuli. But that was just like one little piece. My leg was still constantly in compression garments. I was still very swollen. It feels like it's not a part of your body. Like it feels like it's an alien's and it's not yours. It's very odd. And so then we also did sympathetic lumbar injections for someone who would have it in the upper extremity, right? It would be elsewhere, but that's the point. You go along the spine in the area that correlates to where you're having pain. It's kind of like an epidural, and that too shaves off, like 30-40%, right? What does it have to be for insurance to approve it? And that's what pain management is, right? You're trying to basically, this does 10%, this does 20%, but you're trying to find those bigger ones that like this does 40 or 50%. And unfortunately, with the sympathetic lumbar injections, they only lasted for me like 2 to 3 months, and you can build up a tolerance, just like with any medication, right? So after 3 or 4, it wore off sooner. The effect was less. I got less relief. And that's what essentially then led to, it was implanted 2 years into it, but at about the 1.5 year mark is when we sort of shifted the discussion to the spinal cord stimulator, actually rather a dorsal root ganglion, DRG stimulator, which is almost more like a long-term version of these injections, which are risky too. Anytime you do any procedure with CRPS, even the spinal cord stimulator, you risk really jacking up your nervous system again, and sort of it's spreading either to that area or just becoming more out of control. But you can't live in fear and never do procedures. So it's a balance, right, of also changing the way you perceive that. Right. So that was done 2 years ago, and I've now had it for 2 years. And that's, it's the best as far as the medical system bucket tool. Shaves off 40-50%, I'd say. Right now I can stand, I can use my leg more. It allowed me to then do and progress a lot of the habits from a movement perspective, desensitize, avoid some of the atrophy, and start to address some of the really severe compensations that develop from not using your leg for years. Then you have back pain, hip pain, right? Everything else atrophies in your lumbopelvic hip complex, no matter how strong I look. The brain is smart. It works around what hurts, right? Yeah. So it gets you to a certain point, and we'll talk more about that. And then the big come to Jesus is, what now when I've kind of exhausted what the medical system has to offer, and I'm still really not okay, right? Like I can't imagine my life like this either. And then you start looking at, all right, what do I control? What do I impact? How do I still improve? Okay. So those were the things we did. A lot of people use a lot of other off-label medications, right? I've tried Cymbalta, horrible side effects. Lyrica is another one people use a lot off-label. And it's just tough. Just like with surgical procedures, you're weighing the upside downside of each of these. Do the side effects outweigh the pain relief, right? Is it affecting the habits that would improve pain more than it's improving the pain? If I can't sleep and I can't eat because of a medication, but it shaves off 30% of my pain, is it really? Because then all those other habits being neglected will ramp up your pain. But patients, you look over here like help. So that's the balance.
So the spinal stimulator that was done 2 years ago has given you the longest time where it has given you an opportunity to explore other integrative options, kind of more like supplement the spinal stimulator so that you can start feeling better. Is that fair to say? Like that's when you started exploring like other options?
Honestly, I would say before. At 8 months, at point of diagnosis, I cried in my room for a week. I was devastated. And then I was like, okay, how do I use movement? So it still took, and then the challenge was I was draining myself and paying such a price for pushing myself in the ways I was trying to, I was desperate. Yeah. And so I got to a point where even though I'm doing all these things, I'm not going to last like this. And so what the stimulator does is it just gives you a chance to then layer in things that are more important, but without that piece, you kill yourself, right? A lot of people don't make it. The pain is indescribable. So yeah, I reached a point where what I was doing, as great as it was, could only get me so far. And then when you acknowledge that this doesn't work, you have to take a bit of a leap of faith, even if the alternate road is, very scary and unknown.
Yeah. So along those lines, let me shift gears a little bit and maybe ask you a philosophical question.
Yeah.
Are you like the same person before and after this diagnosis?
Such a good question. The answer would be no. But in a good way, in almost all good ways, other than the pain, like the challenges that the disease and living with it creates. Who I am is a better person, and what I went through before, in a way, inadvertently really equipped me to deal with this. And had I not gone through that, I don't know, to be honest, that I would have been as, it's not that I'm positive, but I've persevered and I feel optimistic. I'm realistic. I'm not sad. I don't not have, I constantly feel discomfort. And that leads to a lot of, negative, very sort of scary thoughts that you have to kind of like fend off and learn how to manage. And, you know, um, everything is different. And so if you don't change, you won't make it. And a lot of the coping mechanisms and skills that we get through life with work until they don't with this disease, because it's tied to your stress response. So if you don't have boundaries and you're a people pleaser and you can't say no, or right, these different ways, you're a perfectionist, right? You work hard constantly because society values productivity. Then you get these existential questions of like, oh my God, who am I if I can't be productive?
Mhm.
Right. And so you have to also learn to, like, how would I put it, love a body that causes you constant pain, that feels like it's betrayed you. Right. And so it's not easy, but being able to sort of look at what you still can do and turning that grief into something that motivates you. And now it's a challenge that I feel up for, in a sense. I didn't always feel like that, right? And I don't always feel like that, but you have to be able to change who you are to manage really difficult situations like this, or else you fight it. And it's sort of an acceptance of what you're dealing with and being willing to see all the cards on the table in front of you, instead of like denial, right? I don't want to deal with it. I don't want to be responsible. I don't want to be accountable. And it forced me to change the intentions behind a lot of things that were unhealthy, even movement, exercise, right? I'm intense, I'm competitive, I'm sort of black and white, all or nothing, push yourself. I had a lot of unhealthy habits around food and exercise when I was younger. And with CRPS, it's changed the intention behind it, because now it's about how I feel and what I can change compensation wise. It's not like how you look or how thin you are, or these sort of aesthetic, those are not sustainable reasons. They're not meaningful enough to do forever. So I'm almost grateful in a lot of ways for what this situation has forced me to do, that I may have never changed about myself if I just carried on through life, kind of being the way I was.
Wow. Well, I have to say, like, kudos to you, and people like you. It's so inspiring, because when we are thrown into something like this is very chaotic, right? Like your life, you like your life to be like going in a particular order, and all of a sudden when you're like thrown into this chaos, it
Yeah.
is catastrophic. And not every person who goes through that phase will come out like stronger than before, right? Like I have seen people, in myself included, when faced with adversity, right, for lack of better words, I can drown or descend to hell. But
Right. Yeah.
you chose to be the opposite of what it is to go descend to hell, and did everything you can. Almost it's like walking on a thin ice, and then it falls apart, you drown, but you learn the skills needed to swim out of that adversity, and perhaps even continue to swim, so that you're able to like do the things that you want to do in life. So kudos to you on that. Just
Thanks.
I mean, that is in a lot of ways, no, at least in my world, when I see cancer patients or deal with cancer patients, not everybody are taking the diagnosis in the same way, right? For some, I tell them you have cancer, and then everything changes. I mean, for everybody, everything changes. But some come out of it in a good way, in the sense their perspective towards life is very different than what it was before. Like what was important before the diagnosis, monitor, like money is
Right.
important, fame is
Please.
important, right? So that goes out the door. And now moments are important, family is important, like giving love and loving yourself is like more important than, it comes, you have to love yourself before you can love others. Like those
Right.
things actually perspectives change. And I'm so glad you actually took the way that you're not only like helping yourself, but you're also helping other people.
And it
And
helps me, right? That helps me. I joke kind of, but it's true. It's like, it's, I'm not as selfless as people think because this helps me too, right? It gives me purpose. And you have to find ways when all these things change to create joy and purpose to compensate for the grief, loss, void, right? And it's a process. It's not like in 1 week you're like, tell me what I can change. Let's do this. I did everything wrong before in the past, in the previous chapter, sort of with the brain injury. And that's why I could do it kind of different this time. And so I see myself, right, and all the people I work with who are upside down sleep cycle, in bed constantly, eating nothing, right, and they think that the symptoms are totally the responsibility of the treatment team, but they just control one piece of it, right? All these other factors that we'll talk about also affect the output of pain, which is the output of a lot of complicated different inputs, not just injury site or disease mechanism,
yeah.
right? So when you decide, you have to choose, right? You have to decide to want to be empowered and being accountable and responsible for something that you shouldn't have to be, in a sense, right? It's not like you shouldn't be in that position and you shouldn't have to, but you have to kind of get over that and be like, but I want to. And then people start to realize how much they affect, and they go from being helpless and hopeless to more confident, right? And they feel more capable, and then they're optimistic about what they can do. And that's where then you start to create positive momentum, and you're changing the narrative, that your brain is telling you of, I can't do this, unsafe, painful. And that's true. It's based on reasonable past experiences. Your nervous system job is to survive, is to keep you alive. And so it's gonna, amplify all those signals if you just let it run amok. And so once people understand how pain works better, and they realize it's not just this thing that the doctor treats, then
Exactly.
you can change a lot. But people don't know that. Then why would they know that? They don't understand really necessarily that pain is an output of all these other variables too. So these conversations are really important so that patients realize it's not your responsibility, as in like it's your problem, but like it or not, you impact it for better or worse. So might as well, right, try to do the right thing in all these different categories. And over time, then you change that sensitivity that your nervous system has rightfully created. It's not in your head, it's not imagined, it's not unreasonable, it's reality, until you start to intentionally change that, right?
Yeah, I think you bring up a very good point that it's all about the right mindset to kind of tune or turn on the positive, aspects of life, and trying to take be your own advocate, like be your own patient advocate, right? Because going to a physician and having them offer some specific things is only part of the puzzle. You will have to work on figuring out what works best for you, because whatever works for you may not work for another person. So,
Right.
so trying to like bring everything together and kind of doing a holistic approach is probably the best way to go, not just for CRPS, but also, let's just say if someone has cancer, right? I can give you chemotherapy or immunotherapy, but you will also have to have a holistic approach on how do I get through this process. It's a lot for someone to go through something like that, right? So bringing that holistic process is very important. So talking
Yeah.
about a holistic approach or integrative approach, I see you have developed your own method called Mars ID method. So can you elaborate a little bit on what that is and how that may help?
Yeah. So these are essentially the main pillars that after years of first experimenting with myself and then working with other people, these are those sort of main dial movers that impact the output of pain. And these are the buckets of things we're working on improving. And not every person has the same priorities, right? When you go through an assessment, certain things jump off the page for people, like their sleep wake cycle or their nutrition, or like, oh my God, they have no stress management tools. So you don't work on the same stuff at the same time because people's resources, goals, priorities, disease stage vary. but you're always working on these things in some way. And the first one is movement, right? So mobility, release techniques, corrective exercise, physical therapy. Essentially, you have to meet people where they're at, which is typically with CRPS and a lot of chronic pain conditions, very sedentary and having not moved or been scared to for years, right? And PT is a pit stop. It's not a progress you over time thing. And so you have to be able to use movement as a tool to gain confidence. It's a lab to change your stress response, right? It's a controlled setting where the dose response is appropriate, as opposed to, I don't know why I flare for no reason. And I get every time I run or swim, this happens. And it's often not the result of just that one variable, right? It's these other pieces that also result in the output. So first you have to get that movement piece appropriately progress for the person. And then that's a huge tool that you change that fear stress response that your nervous system gets ingrained with chronic pain, right? It's learned. And then awareness, that's the A, really is mindfulness, but also awareness of your own body, right? Your own patterns, like I just talked about. When pain spikes, what's going on over here, right? Was your sleep wake cycle terrible? Did you eat anything that day, right? Have you paid attention to your breathing at all? Are you stressed out and crunched and in a ton of pain like this for 12 hours, which happens to me too? I'm not perfect, right? But looking at those things with curiosity and non-judgment instead of my effing body, or like, I can't believe this is happening again. And so when you can remove the judgment from that and start to pay attention to the patterns, that's when also people feel empowered, like, oh, this makes more sense. I'm not just hopelessly like in a tide of pain that I have no clue, right, why it's happening. So it's an awareness in that sense. And then also an awareness on purpose of implementing mindfulness and like, what am I thinking about subconsciously all the time that I don't even realize? Am I living in the distant past subconsciously with my worries? Near past? Am I present? That'd be ideal. Am I worried about like the future in like a couple years? Am I worried about who's going to take care of me when I'm old and alone and sick? And when you actually can pause long enough with diaphragmatic breathing and not freak out to notice what you're thinking, then you can start to change those things too. But a lot of us don't even notice because we're distracted by extreme pain, obviously, right? So working with someone who can kind of help you do that is very helpful to then start to tweak your daily habits and also the mental component from a mindset, right, perspective, like we talked about. And then the recovery, the R, is a humongous piece too, because sleep and recovery is probably the biggest amplifier, lack thereof, of pain that I see. People that are stuck in the 9s, 10s, their sleep is awful. Their sleep quality is terrible. They're often napping constantly during the day, up at night, a lot at night, or just in bed like 18 hours, kind of out of the 24 in total. So working on people's regularity with when they go to bed and when they wake up, that circadian rhythm, getting sunlight, right? Natural sunlight on your eyes, all these sort of little tricks that help your brain know what time it is, so that at night when you want to go to sleep, it's already releasing melatonin, right? And in the morning, it's automatically releasing cortisol like it should, instead of it just being all over the place. And having ways to trigger that, right? Have a wind down routine that increases the parasympathetic. Do breathing then, do release techniques, right? Listen to a recording in bed so that you learn how to manage the anxiety and stress around even trying to fall asleep in extreme pain, which then adds to the pain because you're anxious. Of course you are. There's nothing right. There's nothing wrong with you. Anyone would be. But you have to learn how to be more in control of that because it's your nervous system. You get to have a say. And breathing is one of the biggest, I don't like the word hacks because it's usually not true, but breathing is a true one, right? Where you can stop. If you're doing it diaphragmatically, that's the whole point, and get out of your panty chest breathing, right? And get more costal diaphragmatic, right? So that your rib cage is expanding laterally, ideally 360 degrees, also with your back. And that helps tell your nervous system, it's okay, we're safe. It's not fight or flight, red alarm, there's a tiger, which is what happens with CRPS and other forms of chronic pain. You get stuck basically in a sympathetic state. So you have to trigger more parasympathetic to help combat that.
Wow.
Right, pacing, energy management. The spoon theory is I hate that. It's a very rudimentary way of like, I'm out of spoons. I don't know if you've heard people kind of use that terminology, but it's getting at pacing and, energy management. And you can't just be like, I'm out of spoons. It's like, well, how are you using your spoons? Let's create a strategy, right? For like, not just I use my spoons and I'm chronically ill, so now I'm in bed for 2 days. Well, but like, why? Can we improve that? So people getting a sense of that nap hygiene, right? If you sleep for 2 hours from 2 to 5, you're not going to go to sleep at 10 p.m. You released all that pressure. Think of it like a stove, like a cooker or whatever. And then you want that all to come out at night so you can fall asleep, not release that steam in the middle of the day. But that's how people cope with pain. So it's really hard to undo. My sleep cycle was terrible. I was awful. I had such severe insomnia with the brain injury. So it took me a long time too to get to where I'm at now. And it does take a long time, but it's worth it because then it's forever that you have these skills, right? And then the stress piece, the S, right? Stress management. That also is a lot of breathing, nervous system hygiene, understanding that parasympathetic, sympathetic end of the spectrum and that interplay as is unique to you, right? Your stressors, your challenges, your family, your medical. We go through concepts like the stress bucket and the threat bucket so that people understand that pain is an output of all these different variables, either being more optimized or less optimized. So just like the stimulator takes off 50%, all these different things, 10%, 20%, 5%, 30%.
Wow.
And you get to a different place, then I have unmanageable pain and I can't imagine the rest of my life like this.
So it's very obvious that you have done a lot of research. Maybe a lot of it is trial and error and trying it on yourself and see what works, what doesn't work. So when you got to a point like, okay, this actually is working, I feel the best in many years. So was that kind of your turning point on thinking that maybe I should start a coaching program to help others? Like what was
Yeah.
that moment that you decided to start a program for other CRPS patients?
Yeah. So gosh, it was probably, well, as soon as I got my diagnosis, that was essentially the point at which I was like, I have to figure this out or I'm not going to make it. And movement, like I said, was the most impactful tool. And it's a huge part of who I am and just my personality. And, I played 4 years of varsity basketball in high school. I should have played in college, but I didn't. And I was always an athlete. I was very competitive. And so being so sedentary for so long, it was not going to happen again. And that's when I started investing in getting educated in the movement component, right? And how do you use that from in more intense ways, and also the corrective exercise stability piece, because a lot of people I work with have hypermobility. I do too. So joint laxity, you have to build stability. Like there's no cure for that either. There's no drug. You have to change your body and help your brain, not be struggling constantly. So I knew that going to physical therapy school wasn't it. I had a larger sort of vision for how I wanted to help people. And, I was 30 years old starting over and with nothing. So it didn't make sense either for me to like go to school for 3 years and be 40,000 more in debt and not be. So I had to be more creative. And how could I accumulate this information and know what I need to know to work with a very challenging population who you essentially have to start right with physical therapy. And so I started diving into, before the stimulator, I did a lot of CrossFit because I could only stand in one place. It had to be short, it had to be fast and efficient, and I had like no equipment. It was COVID. You couldn't go to a gym. Terribly inappropriate for somebody with CRPS though, and it caused a lot of compensations. And so I learned from that, right? And once I had the stimulator, that also changed the way that I had to approach movement, because you can't do rapid flexion, extension, or anything dynamic with a wire and leads in your back. So that's where I started to learn a lot more about sort of the corrective exercise stability piece. And then I went through another course through OPEX, where that one was called a certified coaching professional, CCP, where it was more than just fitness. It was the nutrition and lifestyle components. And it sort of gave me a framework and a structure without the chronic pain, mindfulness, or all these other pieces that even a regular person would want to work on and improve, right? It's not just go to the gym. It's how's your sleep? How's your stress? How's your food? My God, for sick people, it doesn't matter less. It matters even more. Why are we left out of the fitness healthcare discussion? I don't get it. And so that's what I was seeing. And also, frankly, there was nobody to help me.
Mm.
Like I was desperate. And so I realized quite quickly that I cannot possibly be the only person in this situation, because that's what happens. You exhaust the relatively, okay options there are medically, and then you're on your own. And so I pieced together essentially the Mars ID method from that sort of framework, different movement certifications that I did, and then a lot of my own personal experience, right? I've gone through mindfulness courses, and then the stress pain piece. Yeah, you learn that, yeah, just through the years of dealing with it. And so it took time to kind of conceptually refine, but then now for over the last 2 years, I've been basically putting this out there, the solutions, this methods, how and why it works, and why it would definitely help you too, regardless of if you have CRPS. Because
Well,
people don't realize, right, how much they affect.
yeah. But well, nothing, in my opinion, nothing is more powerful than your own personal experience and sharing that experience to other people who are going through a similar journey, right? Because only the doctors, again, like I'm going back to the role of physicians or like other healthcare professionals here, they can do so much. They are giving you opinions and their
Right.
evidence-based treatment options, but that's just part of the puzzle. You have to be your own patient advocate, and let's just say we're getting a car. To get a
Yeah.
car, you're doing so much research to get the best car possible, right?
Right.
So to do something for your own health, why not? I mean, I always get very inspired when a patient comes to my office and say, hey, here's the evidence, this is the research that I've
What?
done. Yeah, like the very first time I was like shocked. I was like, wow. And then like more and more I know I received it, and I was like, that is very empowering. The patient has already done their due diligence to do the research, and some of them I pick up from those research in terms of what works for them and what doesn't work for them. And it's revelational, quite revelational. I'm like even more motivated to know
Yeah.
everything possible there is, to research everything there is. If a paper comes out like yesterday, I want to make
Yeah.
sure I give that information to the patient before the patient brings
Yeah,
it.
they bring it to you, right? And it should be collaborative. It should be like this. But honestly, Kavya, even me, I had such imposter syndrome the first even year of being public about like what I'm doing and all of that, because you feel like, why would someone listen to me? I'm not a doctor.
Yeah.
Because I felt like personal experience is not, because I care about academics and education, and like you can't
Yeah.
just be like business. But then over time you do realize like doctors are also limited. They're doing their best, but they literally have no idea what, in many cases, what you feel like or what you're going through, and using you as a resource and your brain to help them work through that is much better than you tell me, like, you decide and I'll just do what you say. Because this comes down to agency. There's no component of that where the patient feels like they're a part of the process and they're impacting their care. And with cancer, there has to be a huge component of, the same thing. If you feel helpless, it does not help your situation. Whereas if you feel like you are empowered and encouraged, you aren't scared to, bring those things to your doctor, feel like
Yeah,
you are in the right to often.
exactly.
So I appreciate you saying that, because it's very helpful for patients to hear it from your mouth instead of me being like, no, there's good ones that want to,
Yeah.
advice.
Initially I felt like, oh, wow, initially I felt a little odd, but then you realize when you do that, the patient appreciates you more, and then they want to work with you more collaboratively, and they listen to them. It just becomes like a very organic
For the
process.
patient, right? Yeah.
Yeah, because it ultimately helps them. And if they come to me and say, hey, for this particular thing, I want to get a second opinion from Stanford,
Right.
or like
Not like,
MD Anderson, I was like, absolutely, and I'll make every single effort to work with them, talk to them, and then it makes the whole process easier for them to collaborate and do that. So talking about cancer patients also, like patients, a lot of patients go through this similar journey of yours, and some transcend that suffering like a boss, and they are really, like you, unsung heroes in my opinion. So for those people who are on the other side of the aisle, kind of going through this process already, what is your advice on what they can do to help other patients who are like in the starting process in like square one? Like,
Yeah,
is there advice that you can give them, because they are now on the other side and they may think their opinion is meaningless, or they may think that
like I did.
exactly who's going to listen to me, but they don't realize how powerful their experiences are. So what is your advice for people like that who want to help and something more than a cancer support group?
Right, like not more of the same. I think, you know, regardless, you don't have to make it your career or a full-blown professional business, right? You don't have to invest thousands of dollars in education. You can, in this case, write up your personal experience in the sense of think about what really made a difference for you. What do you wish you knew? What just like Kavya asked me, what did you learn from this whole process? And if you can find ways to communicate that to other people, nowadays there's so many creative ways to do that. My God, with the Instagram, so I never used Instagram before I built my business. It's hilarious. I had to learn how to use it for business, not because I want to hang out on Instagram all day, but there's many ways. You can do a blog, you could do little videos. It could be, you know, it doesn't have to be a support group for you to be able to just get it out there and see what you attract. It can be in person, you know, set up something locally to teach more than like to support in the not misery, but in the like you want to be in the solution, not just the problem. And you know, it's kind of like a washing machine. Like before you're here, and then you go through the washing machine and the Mars ID method happens, and then you come out the other side and you're different. So what was that process for you? Right. And I think in whatever way feels good and is in alignment with your personality and how you like to engage, you can do something like that. I'm happy to show kind of how I deliver my coaching, for example, even if someone ever wanted to more professionally kind of think
Yeah.
about how you potentially virtually, right, get, and there's many different softwares that you can use, but it's essentially, for me, it was a process of coupling my personal experience, right, with then investing a lot in the movement professional piece, especially, and other things. But if that's not a part of what you're trying to teach people, you don't have to do that. You can do it without that.
Do you have something to share for people who
Yeah,
may
I
want
can
to
share
do
a little
that?
bit about how this will kind of help it make sense for people as far as exercise, lifestyle, nutrition. Like, what does that look like in an actual coaching situation? So let me share my screen real quick. Well, actually, I can leave it up there and I'll show that screen. Beautiful. Tell me if you can see. Do you see the screen with the, yeah.
Yes, but I can.
Okay. So this, for example, is an app called Coach RX. And for this patient, you see that we have very corrective, very PT style looking workouts that are in here for her, in her case, 3 times a week already. This is a highly like advanced CRPS patient in a lot of pain who's able to be consistent with these habits if you couple it with all the other stuff.
Okay.
So she can give, right, her feedback, then I give my feedback to the workouts in response, like within a day. She's finishing it with breathing. A big tip before and after anything more strenuous, let your nervous system know you're coming, warn it, right? Give it a transition period instead of like from rest to excitation, and then you just move on with your day. Actually being intentional about that helps a lot. And then there's a lot of other things here on the left, but primarily the piece that would apply is lifestyle prescriptions, where, for example, here, we're working on things we talked about, breath work. That also is progressed. Breathing is the most fundamental movement pattern. And you start in supported positions and then you progress it in developmental positions. And then eventually you are ideally, right, being able to breathe and brace during movement so that you pressurize your core well and you're not putting a bunch of extra pressure on your low back. So depending on where someone is with this, they're using different exercises and drills. Then there's a nutrition piece in her case. We talk a lot about the strategy of making things easier on yourself, right? Convenience matters when you have limited bandwidth, step capacity, standing, everything. You have to make it easier on yourself and lower the barrier to entry so that you can be successful. So a lot of it is just strategy sometimes, and people getting the things around them in their environment that helps. And in this case too, right, a desensitization piece where they're in high flares still often because it's early in our coaching journey. So we're really emphasizing her skills around not freaking out even more when that happens, right? Being able to calm down as much as she can so that at least we're not adding fuel to the fire. Just cancel out of this. And then, yeah, like here I don't want to do anything, break anonymity or anything, but yeah, so I can send messages, right? I do have the assessment stuff in here. We do fitness monitoring exercises from time to time, consults. But this is more for me on the back end, right? I have everything planned out and periodized in 6 to 12-week cycles, but we go week to week because with chronic pain, you can't be like, here's your 6-week program. Like, let me know how it went. Right. I have I can take notes on the side. So every appointment, I'm writing things down that I have for next time to go back to, so we've got her equipment in there. So there's different softwares that you can use depending on what are you trying, to communicate essentially. For me, the movement piece is a big one, but if it's not, there's other ones you could use. You could use just Google Docs, right? A shared Google Doc to share some of these things. And you see how you attract what you are. You'll attract people like you. And there's a lack, of not toxic positivity, but like honest positivity kind of. And people are drawn to that. It's just rare. It's too rare, so that's
amazing.
Yeah.
Justine, this is phenomenal. You are phenomenal. More power to you, and more power to you to help, other patients, get better. And
Yeah.
it has been an absolute pleasure talking to you. And I also want at this time take a moment to, say kudos to your physicians and your like healthcare professionals and every single part of the team, not just physicians, but like other team members who have helped you come like where you are today. Dr. Krishnan Chakravarti is your pain specialist at the moment. So thanks to him for help you feel better so that you can do all these other things or supplement all these other things.
I was like, you kind of saved my life, because if I did, they're just pieces, right? But without them, and that's why education around that and making the right decisions around what stimulator, is that really a good idea for me, depending on my goals, right? My body composition, like there's so many factors, and patients need to be able to educate themselves about this stuff so that they're not just dependent, because Dr. Chakravarti is incredible, but he's limited in what he does. I joke that he's like my electrician. He works, that's he does. I am responsible for all these other things. And we did not have conversations around these other pieces because that's not his job. He has 20 minutes every, right, 6 to 12 weeks. And in those 20 minutes, this isn't what we're talking about. That's okay. That's okay. And that's what patients have to realize and supplement on their own. And I think sometimes there is a lack of communication from doctors as far as, hey, I can only take you so far. I'm not God,
Yeah, I think the education, the piece of it is to understand they can only do so much, and it is you have to like reach out and understand your own body and figure out all these other things that works or doesn't work for you.
100%.
Yeah, absolutely. Justin, it is an absolute pleasure talking to you, and I am really hoping to have more conversations like this in the future. All right. Thank you, Justin, and thank you, everybody. Until next time, this is Kavya Kannan from Global Cancer Connect. Thank
Thank
you.
you so much, Kavya. I'll see you later. Take care.